because in the end, they think that's what's going to show value for their money. But process evaluation or process evaluation type activities, and here I'm showing you process, formative, and implementation because they share a lot of strategies and tools, are really important. The other thing to notice is that this figure that I've shared with you, they're meant to be sequential in terms of the stages of the program and then when you would implement different kinds of outcome versus process, or formative versus summative. Just wanted to make sure that that's clear. We don't do outcome before we do process. And what process, formative, and implementation evaluation allow you to look at, or the kinds of questions that you can answer, would be about whether or not the program activities are actually being accomplished in the way that they were designed, or what is the quality of the program that's being delivered. Somebody already mentioned the idea of fidelity. So is it closely adhering to the way in which the program is supposed to be designed, or is it only loosely adhering to how the program is to be designed? And let's say it is only loosely adhering to the design of the program. Maybe there's a reason for that. Maybe there was actually an adaptation that made it more relevant for, say, the population or the context or whatever it may be. So when we look at quality, it's important to not only look at fidelity to the original design, but what adaptations occurred. Actually, I haven't talked much about fidelity. Does everyone understand what program fidelity is? Program fidelity is about what are the critical ingredients that make this particular program effective, and how well is the program that I'm evaluating or implementing, is it adhering to those core principles? Okay? It's really an important component of process evaluation that often gets overlooked. Maybe because there's not always easy tools to implement or to use, because a fidelity assessment has to be tailored to that program. And so you may not find something in the literature which is a fidelity assessment to housing first approaches. So sometimes you have to develop them yourself. Okay, how well were activities implemented, sort of related to the quality of the program? Was the target audience reached? How did external factors matter? So those are the kinds of questions that we can answer with process evaluation. Now, why would we do a process evaluation? Well, one is for accountability, okay? And this is totally separate from outcome evaluation. Are the resources really being used in the way that they were intended? Also, to inform outcome evaluation. If you did a process evaluation, and let's just say the worst possible outcome happened, that is, it's not it's not sticking to the main ingredients of the design of the program. So fidelity is very low, hardly any of the target populations being reached. Actually, they're serving a totally different population altogether, and the staff aren't very well qualified to deliver it. Would you do an outcome evaluation? Or should you do an outcome evaluation? No. I don't think so. I think it would be a waste. I think we already know what the result of the outcome evaluation would be in that instance. I think you would probably see no difference. You might actually show worse outcomes than usual care. So to inform the outcome evaluation, not only from the standpoint of should I do one or shouldn't I, but also it can help explain if you have a negative outcome evaluation, that is, the program wasn't that effective, it can help explain why that may be the case. Maybe you did detect low fidelity. Maybe you did detect that the target population that the program's intended to serve isn't being served, et cetera. And then for program development and improvement. When you do a process evaluation, you know what's happening, or formative for sure, then you can, and implementation actually, you can improve your program, or implementation, which you'll hear about in a little bit, helps to guarantee that when you implement your program, it's done so in a successful way. And then program replication. Okay, so these are the reasons why one might do process evaluation. or argue with the funder as to why a process evaluation is important. Okay, so these are the different kinds of process evaluation questions that one can ask and answer. Everything from how many persons are receiving services, is the intended population being served, are they receiving the right amount or the right quality of services, are there groups who we wanted to serve who are not getting services, is the target population even aware that this service exists, are the staffing, do we have sufficient numbers and competencies for the functions that must be performed? So you can read that or get a magnifying glass and read the one on your screen. But there's sort of a whole wealth of questions that are really critical important to inform the program and whether the program is functioning well that you can ask when you think about process evaluation. Okay, so if this is a brainstorm, imagine this was the brainstorm for the program, how would you decide which one of these to prioritize? What's one strategy you might use to decide which one of these should I prioritize for my evaluation? Sorry? Okay, one is feasible. Yeah, am I even able to have the money to reach outside of my target population to see if anyone's aware of it? Okay, what's another one?
What needs to happen first? As in, you need to find your target population before you interact with them. So
Okay.
first.
Okay. All right, so
Based on your logic model, the certain, like...
yeah, think about a sequence of early questions versus later. What else? Participant organization. Okay. I was actually looking for something else. Yes. Yes. Ask your stakeholders what they want and what their priorities are. All of the answers that you provided were not incorrect, but yes, that's one of the first things you want to do is say, okay, who's going to use the answer to does the governing board, funding agency, and higher level administration impose the program in compliance with the requirements? Who's going to want to know the answer to that? If nobody, then don't use it. All right. So very briefly on types of data to collect. Definitely quantitative data. We are epidemiologists after all. And so we want some numerical data that can be counted, quantified, and mathematically analyzed. So we can use, for example, program records, especially if they're electronic, contact tracking, data matching with other organizations. I don't know if you've tried that. That can be a challenge, but it can also be a useful source of information. We can do pre and post tests. So pre and post tests means we've delivered something, but we have a baseline value before we delivered the intervention, and then a measurement after, and then surveys. Okay? But we can also use qualitative data. So qualitative data answers questions of how and why, and it gains in-depth insight into experiences, behavior, and beliefs. Often it represents the voice of that particular group, whether it's program staff versus an evaluator or a funder, or the target population. And it's not necessarily intended to generalize to the population like quantitative data are. And in fact, sometimes you want maybe unique pockets of people. So you may want to know, okay, I know there's a certain subgroup of my target population that I'm not reaching. I wonder why. So you can purposefully select a subgroup to look at with qualitative data. Some of the downfalls is perhaps it might be more time consuming, especially if you can't use secondary qualitative data, which is very rare. And then to analyze it might take a long time. Okay, and then also because you're less focused often about the approach for qualitative data, you may end up with some information that wasn't necessarily directly relevant for the question you were asking. That's not necessarily a bad thing, but then you have to figure out, okay, what do I do with this new information? So you can do document analysis, analyzing minutes from meetings, you can do observations, journals, so there's a number of different ways in which you can collect qualitative data. So this is just some, I want to make sure everyone kind of has the same information to be thinking about as we design our own process evaluation. Let me see, so first of all, do you have any questions about process evaluation? We're going to get a chance to practice, actually. Yes?
So I'm thinking that for the process evaluation, you don't really want to use secondary data. You really want to use more primary data. Is that correct?
Asking or stating? Well, you could use program data. So let's say there were client records.
Okay.
That's, to me, program data, and that's secondary data. Yeah? So if you have case managers who are entering their notes or whatever, or there's maybe a form that they fill out. So I'll tell you about that housing project that I told you about, the Housing and Health Project. They actually have, for better or for worse, they've adopted somebody else's kind of risk assessment form, and they have that online, and it goes into a database, and they fill that out. Now, the disadvantage of that is it's not complete. It's only one aspect of what they're providing services on for the clients, but they've decided to use that, and so that would be secondary data. We could take that data, client level, and analyze it. Is it all the data we need on them? No. So then there's maybe notes and things like that that we'll have to supplement it with. But that is an example of secondary data. Were you thinking of something else?
No, I'm just trying to put it in.
Yeah, great. Okay, good. Has anyone used secondary data for process evaluation? Yes, you have, or you have a question?
Oh, no, I have.
Oh, okay. Can you describe what secondary data you've used?
Yeah, so we were doing, so this was my previous job, we were looking at the acceptability of a storytelling-based intervention to improve women's prenatal oral health.
Okay.
And so this was among Native American tribes in California.
Uh-huh.
And so one of the things we wanted to see was like before and after the intervention, whether they had increased their visits.
Okay.
That was one of the things. You know, there were a lot of other things, like visits to their providers.
Okay. So the secondary data you used were about visits. So you could count visits.
Yes.
You knew when they attended the intervention.
Yeah, we had
Okay.
their birthdays and their names.
Great.
And we just,
Good. So, okay. That's kind of an outcome evaluation too, potentially. Right? Increasing visits, yeah? But maybe you were trying to, maybe visits was part of the intervention and then you had another outcome, but. Good. Did you? Oh, no, hand's not up. Anyone else use secondary data for process evaluation? No. Okay. It is less common unless you have something like an electronic record or electronic medical record. So you may end up collecting a lot of this data on your own, especially for some of these questions. Are you reaching the are there members of the target population who aren't aware? I don't know that there's going to be any secondary data for that. Yeah. So question, did you have your hand up?
I think we're using birth data, for example, birth records to identify whether or not we captured our target population or not. So I guess that would be an example.
But birth data alone?
Yeah, part of the question to be answered was just our birth records, because we have an intervention that targets pregnant and parenting women.
Okay.
Who are generally around 20 plus weeks pregnant. So we know that our birth records and to some extent our fetal death records can identify the capture group that we should be at least engaging or recruiting. So we could match and do a linkage between who we actually did recruit and who we actually did get into the program with, who delivered a live infant or had a pregnancy.
Are you linking those data? Oh, okay. And you have a target area? Is that how you know who's eligible? Okay. So did everyone understand?
We will do that.
Okay. We've tried to do that too, but there's all kind of challenges, at least in the records that we've used. Women don't always use their home address. They may use a different address, and so our idea of, from the birth records, who's in the target population is, there's misclassification there. And
Successful yet, but we're
got it.
theoretically we improved how we do our work.
Okay. And you had a comment.
Well, I think you were asking for examples.
Yeah.
At first think of it, but we link our birth file with the WIC program administrative data, looking at, so that we could cut women into WIC participants and when they enroll.
Okay.
Ineligible or eligible but not participating women. And then in our MECOS sample, which is also LinkedIn or survey, we asked those not participating why.
Okay.
Why they didn't participate.
Okay, good. So there's some secondary data there. Great. Good examples. All right. So let's move to an example of process evaluation, and then we will do our exercise after lunch. So I thought we could walk through one together. How does that sound? All right. I'm not hearing any resistance, so I'm going to do it. See, you had your chance. You could just, no. All right. Yes. Well, try it again, sorry. All right, it's only on the screen, so let me see if I can do this. No, I can't, definitely can't. What I wanted to show you was, I thought what we could do for the organizational level and a process evaluation, so everyone has their process evaluation, their logic model for the organizational level. There we go. I thought we could look at one of the components that's happening at the organizational level, which is about employment. Okay? So I've kind of highlighted the activities that I thought were involved in employment, because one of the things you're going to be asked to do in your process evaluation is undertake a process or design a process evaluation for one of the components at one of the levels, okay? So I've picked this then. So if you look at your organizational level, you can see that, see if I can make this a little bit bigger. All right. So interested employers, right, are some of the inputs. Job placement firms are some of the inputs. And then in terms of activities, we've got incorporate housing and social determinants into Healthy Start in Housing goals and measures. We've got contact potential employers and job placement firms about program involvement. We have number of interested employers as one of the outcomes, and a number of interested job placement firms identified as one of the outcomes. Just making sure that, yeah, okay. And then we have, as some of the short-term outcomes, you know, increased focus on social determinants and policy programs among the health organization, strengthen ties with community employers, improve staff competency by developing economic self-sufficiency, and increased opportunity for clients to find stable employment, okay? I think those are the components of the logic model that are involved in employment, all right? Any questions about that so far? Okay, so now what might be, so take a moment to think about this, but what might be one or two questions, process-related questions, evaluation questions, process-related evaluation questions that we might formulate based on these particular activities? Now remember, probably not going to involve the outcome very much, right? So we're not going to be that interested here. We're going to be interested more here. So just think for a moment, what might be some process questions that we might ask? And does everyone see where that is on your own? And I think, Olivia, did you put the full logic model on the Google Drive?
Yes, it's, the full logic model is now in the exercises folder, so you can easily access it. It's a resource for all exercises.
But I think these are here already. Okay, so who's come up with a question that might be a process question?
How about whether or not we have enough interested employers?
Do we have enough interested employers to meet the demands of our particular client population? Great. What else? Yes.
Who are those employers and also what,
Okay.
their mode?
Right. Are they all at McDonald's, or do they cross different sectors? And good. Yes. Okay, so what does, maybe since we're focusing on employment, does the social determinants of health that we're focusing on incorporating include enough of a focus on employment? Good. What else? Yes?
What job skill set do we need to fit the employers that have jobs for our clients? So for the job placement firms, just to make sure that they actually provide training. Their training matches up with the jobs that are available.
So you're talking about what skills do the target population need to match up with? Great, good question.
The skills that the job placement firms offer.
Offer, yeah.
Being clear.
Yeah, I understand. So what kinds of skills are the job placement firms providing to the clients so that they'll be well matched to the jobs that are available? Great question, yes?
Are our jobs, our employers and our clients located in the same areas? Or are we
Wonderful, good. Do they have to, that's really important. Thank you. Because research has shown that women in particular, when they're head of household, need to be very close to their jobs. They can't spend 2 hours commuting to a job because they often have to be home when a child is sick or get home quickly after work. That's a great one. All right, one more. You don't need to practice. You're doing a great job. That wasn't a joke. All right, what else? One more. So I came up with some. I think yours are better. Let's see if I can do this. Okay, other way. Oh, sorry, here's some more that I missed. Hold monthly or bi-monthly meetings with employers and job placement firms. Train Healthy Start in Housing staff to connect clients with interested employers and job placement firms, okay? So those you have to work with too. All right, so here's some that I came up with. Oh, and do you see what they are? Let's see. All right, it's a secret. Here we go. All right, so how many potential employers are being reached? I think somebody said that. What is the quality of collaboration between the Healthy Start in Housing organization and the employers? So are they strong connections? How supportive are the employers of the Healthy Start in Housing's target population, right? And how can those support levels among employers for that population be increased? Are there potential employers not currently engaged? Is Healthy Start in Housing staffing levels, that is the number of people, the qualifications of the staff, and their experience sufficient to support this activity so that it's carried out well? And how strong is the institutional support levels for a focus on employment. Okay, so these are just other examples of process questions that we can answer. So what I'm going to do then is we're going to continue this a little bit after lunch, I think, to talk about data sources and how we might do it, and then you'll do one. So we're doing one together, and you'll do one with your partner after lunch. And I think now you're going to hear about implementation evaluation. You're going to plug in, so you don't need this? Do you need help? No, it's theirs. Okay, all right, good.
You guys want to stand up and stretch for a minute while I'm getting ready?
No, that's fine. Yeah, okay, good.
Screen is blank, I don't know.
Oh, thank you.